Hello, this is Dr. Gay from First Like MRI, and this is a 43-year-old male who has injury of the foot. They're worried about the possibility of a foreign body in the foot, and usually we don't like to do MRI for foreign bodies because CT just shows them a lot better. If something's metallic, it shows up great on X-ray, which is really cheap. If it's non-metallic, then CT is good because a piece of wood or sliver may be low in density, more close to air, and show up really nicely on CT, but an MRI, it may not be very well seen. So this is an example. Again, we didn't want to do the exam, but the patient begged us to do it. The doctor said, please do it. We explained it may not show it, but in this case, we do see that there's a loose body. I'm sorry, a foreign body rather in the foot. So here we go. This is a view. You can see the first, second, third, fourth, fifth metatarsal bones. This is in the forefoot. And we see an unusual band coming across here. This is where they have a soft tissue injury. It looks like a puncture went all the way through here and came out over here. Bad injury. And on this you really can't see very much, but in retrospect there's a little curvilinear band here that is the foreign body within the foot. So now we're going to put up another view, and this view has fluid bright. So it's a bright fluid sequence, and we can see on this view the foreign body right there. I put a bunch of markers here. This one shows the fluid, which is bright, the edema and hemorrhage, and we see this area right here. That is the foreign body. And now we do see this because it is so large and it's surrounded by this edema and hemorrhage. But you can see it's very similar in signal to the muscles here that are gray. It's the same shade of gray. If there was no fluid around it or wasn't outlined, it was just embedded in the muscle, maybe invisible, almost impossible to see. And again, this is very large. So this is an example of a case of a foreign body from an injury. This is a view here where we really can't see it very well. Again, this is a T1 weighted image. It's in here somewhere, but you just really can't define it very well. But if we put up the fat suppressed sequence here as before, we do see this foreign body here well outlined by this fluid, and there it is, showing up well. And then just last view here, just to take one more look, and there it is. This is a coronal view. You can see the metatarsals here, the big toe over here to get oriented, and there's that foreign body surrounded by the edema and hemorrhage and showing up pretty decent here on the MRI. But again, we don't like to do these because CT is the preferred choice. Thank you so much.